Dr. Bunch, thank you for being with us today. We're excited to talk about some of the research initiatives that you'll be sharing at Heart Rhythm Society in Chicago. Let's talk about some of the exciting and innovative studies underway at Intermountain Healthcare and the Intermountain Medical Center Heart Institute.
Oh, thank you for the opportunity. This is a big year for us. We've had 16 abstracts accepted from our group, some with some very great collaborations and others that were a little bit homegrown. We're going to be discussing a novel large animal model that will develop atrial fibrillation spontaneously. In particular, we'll develop atrial fibrillation with exercise, which may be a model for exercise-induced arrhythmia. We have studies on, ongoing studies on dementia, how we can, with atrial fibrillation patients, how we can minimize that risk. What are some key risk factors that are new and to be discovered? And we have studies also on ways to improve our risk stratification of patients, dynamic measurements that we can use over serial test over time and really understand a person's risk at that time for stroke with atrial fibrillation or bleed with atrial fibrillation or even dementia. So those are some of the things we've done from a homegrown standpoint. Then we've also reached out with collaborators from UCLA, Harvard, Kansas, Colorado, and the University of Pennsylvania to form a collaborative institution where we study ventricular tachycardia ablation. And it's not done that often, so in strength, in numbers, there's great strength. So we're able to look at unique groups that we hadn't studied before, very sick patients with ventricular tachycardia that we hadn't studied before, and look at key parameters on what will guide their success. In fact, this is a group that also involves many international collaborators as well. And then we've also looked at some of the things that we're struggling with at this time. What can we do that's more cost effective in atrial fibrillation? Is ablation cost effective? Is the way we manage patients for stroke prevention cost effective? And so we've collaborated with other institutions looking at our therapies and which is the most cost effective. And it's reassuring when we see those things that we're doing the right thing and we're on the right track.
This must be an exciting time to be in the area of rhythm treatment with all the developing technologies and the understanding of how we provide best care possible.
Yeah, definitely. We've gone from a field that 25 years ago that we would try a drug over and over in the hospital and often watch it fail to new insights through technologies that allow high definition and high density mapping. We're able to understand rhythms that we haven't before. And not only that, we have new therapies that can go right to the source and treat it, whether they're stroke prevention therapies, therapies for abnormal rhythms, new device technologies that are making patients live longer, have better quality of life, experience less heart failure. So all the technology and the marriage with technology with a profound scientific background from many of the pioneers that taught me and others, it's become a unique time of growth and learning.
Yeah, you and your team here at Intermountain are involved in a lot of research. Why is research so important to our understanding of this process and to improving the care processes that we provide for patients?
Now, research is essential for medical growth. We have to constantly ask questions and improve our understanding, and we really want to be on the forefront of that. We want our therapies to be 100%. We want our understanding of mechanisms to be 100%. We want to ask questions on prevention that ultimately may put us out of business, but we're doing the right thing for patients by preventing diseases that ultimately will cause them to suffer and have poor quality of life. But it all begins with not accepting the status quo. It begins with asking questions and being willing to take the time to explore and research those questions and accepting of the outcomes when they become uncovered.
Well, congratulations on all this exciting work happening here, and we look forward to much more to come.
Thank you.
Thank you.